Hi, my name is AHMAD AZIEL RAHMAN from Diploma in Physiotherapy. The topic of this video are sport injuries and rehabilitation. Why I'm so interested to talk about this topic because I used to be a school athlete and I had an ACL injury on my knee. So firstly, I will explain to you the meaning of sport injuries and rehabilitation. So let's move to the next slide. The meaning of sport injuries is involved damage to part of your body due to sports, exercise, or athletic activities. Meanwhile, rehabilitation is the process to regain full function following injury. This involves restoring strength, flexibility, endurance, and power, and is achieved through various exercises and drills. There are three content that I will explain to you. First thing first, do you guys need to know about the fundamental sport injuries and rehabilitation? I will help you to understand the different types of injuries that can occur, the various rehabilitation techniques that can be applied, and the importance of understanding human movement to aid rehab and recovery. So let's move to the first point. An injury is any kind of pain or physical damage that occurs as a result of sport exercise or physical activity. Acute injuries refer to injuries that have happened in the moment, such as falling over and spraining an ankle, and usually relate to anything up to 72 hours after the incident. Whereas chronic injuries are issues that develop slowly and last a long time. They can also refer to as overuse injury, such as tennis elbow or shin. Type of injuries include a spasm, which is an involuntary contraction to protect muscles by stopping it moving. A sprain, which is an overstretch or a ligament. A strain, which is an overstretch of a muscles or tendon. Erythema is reddening of the skin, and ovulation tear, which is a tendon and torn of bone. And for the last one, oedema refers to excess swelling. Injuries can be caused by a wide range of factors which can be split up into two main categories. Extrinsic risk, which looks at factors external to the body, it can cause injury, such as inappropriate coaching or instruction, incorrect technique, environmental conditions, other athletes or participants, and clothing and equipment. Other than that, extrinsic risk look at the physical aspect of the individual body that can cause injuries, such as an inadequate warm-up, muscular imbalance, and postural issues, poor technique, overuse, and age. There are a number of rehabilitation methods that can be used after an injury has occurred. Depending on the severity of the injury, will depend on the most effective rehabilitation strategy. Let's take a look at some of the most popular rehab techniques. The most common form of rehab after a mild acute injury is RISE. R stands for rest the injured part of the body. I is the affected area to reduce inflammation and pain, and C is compression, which can include strapping or taping to reduce the damage of a swollen area. And for the last one, elevation above the heart causes gravity and sun fluid pull towards the body scale. Let's move to the next point. Massage consists of a series of techniques that manipulate the soft tissues of our body. The benefits of massage include relaxation, reduce muscular pain, including the late onsets of muscle soreness or DOMS, which is the pain or discomfort often 24 to 72 hours after intense exercise or activity. Stimulation or lymphatic flow, reduce stress, tension, increase mobility and flexibility, aid soft tissues recovery, and increase localized and general circulation. Point number 3 is stretching. Is another form of manipulation uses a series of techniques stretch the neuromuscular system into improving flexibility. Meanwhile, static stretching is the process of passively taking a muscle to the point of tension and then holding that stretch for a specific period of time. Besides that, dynamic stretching is an active extension of a muscle using force production and momentum to move a joint with full available range of motion. Point number 4 is Icebox or cryotherapy. Icebox or cryotherapy is the process of total body immersion into cool water shortly after exercise in an attempt to enhance the recovery process. Despite the science still not fully understood, Icebox aim to decrease cellular metabolism, decrease inflammation, decrease pain and spasm. For the last point of this video is human movement. We can describe all human movement in two imaginary planes or pass through the center of the body. The sagittal plane divides the body into left and right halves and include movement such as running forward. The transverse plane, which is creates upper and lower halves and includes movements such as swinging apart. I think that's all from me. I hope you guys got something benefit from my video and enjoy this video. Thank you for your attention. If you guys have any question about this video, just put down in the comments and I will reply. Thank you.